My name is Charles Moxley. I'm a veterinarian. I practice in Warren, Ohio. I have ownership of a 8 to 9 veterinarian practice with about 50 staff. We are open 7 days a week, 8 a.m. till 10 p.m. And we have a full service veterinary hospital. It is not a specialty practice, general practitioners. I have a staff of about 50 who include 10 to 12 veterinary technicians and then ancillary staff that go along with that. The practice has been in existence since 1968. We built the facility that we are in now about 15 years ago, and we've used the Alpha Wasserman machine in about 4 different iterations now over about the last 20 years. And it's been an integral part of our success. It allows me to provide very accurate in-house laboratory work, real time with a minimum of cost, and it has been a wonderful addition to our practice that probably allows me to keep 4 to 5 employees that I wouldn't otherwise not have. So Beth is drawing blood from one of our patients right now to do a general health profile. Very simply, this is the same process that you would go through to draw that same sample if you're sending it out to an outside lab. So up to the point of placing the blood in the machine, the process is exactly the same. Draw the blood, place it in a container, centrifuge it properly, and we can do this without the inherent error that's introduced by giving it to a courier and running it to an outside lab. So we simply go from patient to machine with no error introduced into the process. So now you see our technician, Beth, placing the sample. We've drawn blood from this patient. She is going to place the sample in the machine. We've run this in plasma. We've already spun it in a centrifuge. She's going to place it now. And once it's placed, she's going to close the machine, and we're going to run a general health profile, which will be equivalent to your Chem 17 or your Chem 20 that you send out to an outside laboratory. The machine will run a full biochemical profile, including kidney function, liver function parameters, blood glucose, all the electrolytes, calcium, and whatever you program the machine to run, it will run. And so you can customize profiles, you can customize large ones and small ones based on what your needs are for pre-surgical or emergent cases. And the machine is very user-friendly in the sense that it allows you to customize the type of testing you need for the practice that you have. So the machine just finished running the tests after about a 10-minute run time. Beth has the results. She'll review those, bring those to me, and I will be able to interpret them and give my clients real-time patient information in over a 10-minute period. If you have multiple samples to run, you can be running multiple patients in the machine at the same time without having to reload the machine each time. So if you have a wave of surgical patients in the morning, you can put 5, 6 patients in the machine, run them all, proceed with your surgery day, and all the results will come out together. Financial advantages to something like this need to really be looked at. So as a veterinarian in a busy practice, please take the few minutes necessary to think about the future of what your practice looks like, the type of medicine you want to practice, and understand that this machine will pay for itself in any practice that has 3 practitioners or more. It improved our quality of care dramatically. The reason it has done so is because I get real-time results without waiting for them, without introducing artifactual error that comes along with having a courier pick up your samples and take them to an outside lab. We see a lot of emergent cases because of the hours that we're open. Those cases require real-time lab work, and it improves patient care because I can get those cases dealt with. I can get those cases diagnosed and treated in a more efficient manner, and that translates out to better patient care. When you listen to people talk about practice management, there's this constant emphasis on cutting cost. And what the machine allows me to do is not only cut my lab costs, which was one of the 3 or 4 largest bills that I had to pay every month, it also allowed me to redirect that revenue back into the practice. So my reagent cost for a biochemical profile is about $5 per patient. Additionally, if I send that to a laboratory, my cost for that same test would be anywhere between $15 and $20 for that same test. Those extra dollars I can then turn back around, keep in the practice, and use that to pay salaries, provide services, buy equipment, and it makes me more competitive because I can keep the dollars in the practice. My patients benefit because I have real-time lab work that I can talk to clients about either while they're in the room or later that day. We can do a much better job of rechecking, monitoring diabetic, kidney failure, liver disease patients with real-time lab work with a minimum of cost and a maximum of revenue generation. And this machine has been an integral part of getting that practice built. One of the things I'd like to reiterate to the veterinarians out there is that the idea that wet chemistry is impossible to manage or it's much more difficult than dry chemistry really needs to leave the conversation. I've had extensive experience with dry chemistry units, and when we switched to this wet chemistry unit, the argument always was, well, the average guy can't manage wet chemistry. I believe that nothing could be further from the truth. I have veterinary technicians who are very well trained, who manage this machine, and they do a wonderful, wonderful job of maintaining it. It is not a difficult process at all, and when you switch from dry chemistry to wet chemistry, that allows you to drop your reagent costs to the point that it becomes a financially viable alternative to sending lab results out to an outside lab. Laboratories have made it very simple for you to send your lab samples out, and they have made it very simple for you to get results back. But I would like the veterinary world to at least explore the idea of improving the quality of our medicine by improving the results that we get and the speed with which we get them. Thank you for your time.